Are injections safe for treating back pain? Are those back pain injections really helping you, or just hiding the pain for a while? You'll be shocked to know how many people over 40 are depending on injections that may only give temporary relief, and sometimes make the problem worse in the long run. If you've ever been told, just get a shot and you'll feel fine, stay with me till the end, because this video could save your spine, your wallet, and your future comfort. Back pain is one of the most common health issues among adults and seniors. It's the silent struggle that affects your sleep, your energy, your daily movement, and even your mood. For millions around the world, injections like epidurals or nerve blocks have become the go-to solution when pain pills stop working. But here's the truth. While injections can seem like a quick fix, the real story behind them is much deeper. 1. Why people turn to injections. When you're living with chronic back pain, especially after 40, every movement can feel like a battle. You've tried stretching, hot compresses, painkillers, maybe even physical therapy, and yet the pain keeps coming back. That's when the doctor mentions the magic word, injection. These injections promise fast relief, within hours or days. They're often suggested when your pain is linked to inflammation, nerve compression, or arthritis in your spine. The idea sounds simple. Deliver medicine right to the painful spot, stop the inflammation, and you're good to go. No pills, no surgery, just a small shot. But most people never stop to ask, what's actually inside that injection? And more importantly, is it really safe for my back in the long term? 2. What's in a back pain injection? Let's break it down simply. Most back pain injections contain a steroid, like cortisone, and sometimes a local anesthetic. The steroid works to reduce inflammation, basically calming down the irritated nerves or swollen tissues. The anesthetic, on the other hand, gives quick numbness and short-term comfort. You might have heard terms like epidural steroid injection, ESI, facet joint injection, nerve block trigger point injection. They all sound different, but the goal is mostly the same, to reduce pain by calming inflammation or numbing nerves. Sounds safe enough, right? But here's where it gets tricky. 3. The temporary relief trap. Most people report feeling better right after the injection, sometimes within hours. The pain fades. You move freely again, and life feels normal. But what many don't realize is that this relief often lasts only a few weeks or months. After that, the pain can return, sometimes worse than before. Why? Because injections don't fix the cause of the pain. They just silence the signal your brain receives. It's like turning off a fire alarm while the fire still burns underneath. And here's the kicker. If you rely on injections too often, your body can start depending on them. Over time, the tissues in your spine, muscles, ligaments, even bones, can weaken from repeated steroid use. That's why doctors usually limit how many injections you can get per year, often 3 to 4 max. 4. Why back pain is so common. After 40. To understand whether injections are worth it, you need to know what's really causing the pain. For adults and seniors, it's rarely just one thing. Years of sitting, poor posture, weak core muscles, and spinal wear and tear all add up. Common reasons include degenerative disc disease. The discs lose flexibility and cushioning. Spinal stenosis, narrowing of spaces in your spine, pinching nerves. Herniated disc, when the soft gel in the disc pushes out and presses on nerves. Arthritis in the spine, causing stiffness and inflammation. These are chronic conditions, meaning injections can calm the pain but not reverse the underlying cause. Think of it like painting over a cracked wall. It looks smooth for a while, but the damage remains underneath. 5. The emotional side of back pain. Many people in their 40s, 50s, or 60s start feeling helpless. The pain limits movement, steals confidence, and affects sleep. It's natural to look for anything that offers relief, even if it's temporary. You just want your life back. That's why injections feel like hope in a syringe. But sometimes that hope becomes dependence. And that's where caution is needed. Because while 1 or 2 injections might genuinely help, Turning it into a regular habit could create long-term issues. 6. Are doctors to blame? Not necessarily. Most doctors recommend injections as part of a broader plan, not as a permanent fix. The real issue is how many patients stop after getting 1 or 2 doses of relief. They skip physical therapy, stop strengthening exercises, and never change posture habits. When the pain returns, they go back for another shot, and another. Before you know it, the body's natural healing slows down because it's constantly being artificially numbed. So the real question isn't just, are injections safe? It's, are you using them wisely? Scientific research shows that while back pain injections can be effective for short-term relief, their long-term benefits are limited. In fact, many studies have found that after 6 months, people who got injections felt about the same as those who just followed exercise and lifestyle therapy without any injections at all. That doesn't mean injections are bad. It just means they're not the miracle cure they're often advertised as. Types of back pain injections, how they work, and what to know. 1. Epidural steroid injections, the most common option. Let's start with the most popular one, epidural steroid injection, ESI. You've probably heard this term if you've ever been to a pain clinic or orthopedic specialist. How it works. When a disc bulges or a nerve gets compressed, it causes inflammation. That's what triggers pain down your back, hips, or legs, like in sciatica. The steroid reduces that inflammation, and the anesthetic quiets the pain signals to your brain. Many patients report near-instant relief, sometimes within 24-48 hours, but the results vary. For some, it lasts a few weeks. For others, it may provide several months of comfort. When doctors suggest it, herniated or slipped disc sciatica or nerve root irritation, spinal stenosis, narrowing of the spine, post-surgery inflammation. The downside, epidural injections don't fix the disc problem, they only control swelling. And if used too often, the steroid can weaken nearby bone and muscle tissues. Most doctors limit patients to 3 injections per year for safety. 2 facet joint injections, targeting the small joints. Your spine has dozens of small joints called facet joints. They what allow your back to bend and twist smoothly. Over time, these joints can develop arthritis or stiffness, especially after 40. That's when doctors might suggest a facet joint injection. What's inside? Again, it's a mix of steroid and anesthetic, injected directly into the small joint capsule. How it works. The anesthetic gives immediate pain relief, and the steroid reduces swelling in the joint over the next few days. Some people feel better for weeks, others get relief for months. When it helps, localized lower back pain, not spreading down the legs, arthritic pain from aging joints. Stiffness after long periods of sitting or standing. The downside, facet injections can wear off quickly if the joint damage is severe. Overuse of steroids may also thin the joint tissues. Plus, if the injection isn't placed precisely, it may not help at all, which is why experienced doctors use X-ray or ultrasound guidance to position the needle correctly. 3. Nerve block injections. Silencing the pain signal. Now, this one's interesting. Nerve blocks don't just treat inflammation, they target communication. What's used? A small dose of local anesthetic, sometimes mixed with a mild steroid, is injected near the affected nerve. How it works. When the anesthetic blocks the signal, the brain stops hearing pain from that nerve. This helps doctors confirm which nerve is causing the issue. If pain relief is immediate, that nerve becomes the prime suspect. Sometimes, if the block works well, doctors might later perform a radiofrequency ablation, RFA, where they use heat to destroy that nerve, pain signal permanently. We'll discuss that later. When it helps, nerve root pain from herniated discs, chronic nerve irritation, diagnostic purposes, to locate the exact pain source. The downside, the relief from a nerve block usually lasts a few hours to a few weeks. And because it doesn't repair the nerve or tissue damage, pain can return once the block wears off. 4. Trigger point injections. For muscle-related pain. Sometimes the pain isn't from the bones or discs, it's from tight, knotted muscles known as trigger points. These are small, sensitive spots that form when muscles stay tense for too long, common in the upper or lower back. What's used? A local anesthetic, sometimes mixed with a saline solution or small steroid dose, is injected directly into the knot. How it works. The injection releases muscle tension, increases blood flow, and helps the knot relax. Many people feel relief almost immediately. When it helps, chronic muscular back pain, tension from poor posture or long sitting hours, pain that radiates but isn't nerve-based. The downside: trigger point injections can relieve symptoms but won't fix underlying posture or muscle weakness. Without regular stretching or strengthening, those knots come right back. 5. Sacroiliac, SI. Joint injections, the hidden source of pain. The SI joint sits between your spine and pelvis, a small but powerful connector that helps transfer body weight from your upper body to your legs. When it gets inflamed, common in older adults or after falls and injuries, the pain can feel just like lower back pain or sciatica. What's used? Steroid plus anesthetic mix, injected into the joint space under X-ray guidance. How it works. The medicine calms inflammation and restores movement. People who've had long-term stiffness or one-sided lower back pain often feel much better afterward. When it helps? Sacroiliac joint inflammation or arthritis, pain on one side of lower back, hip, or buttock after trauma or long-term imbalance. The downside: as with other steroid shots, relief might fade after weeks or months, and overuse can cause weakening of nearby tissues. 6. Radiofrequency ablation, RFA, the next level treatment. When nerve blocks work but only temporarily, doctors may suggest radiofrequency ablation, RFA. This isn't exactly an injection, but a procedure where a small needle delivers heat to a targeted nerve, stopping it from sending pain signals. The advantage: results can last for 6 months to 2 years, much longer than injections. The risk: the nerve eventually regenerates and pain can return. Plus, there's a chance of mild numbness or soreness afterward. 7. So, which injection is right for you? That depends on your diagnosis and your lifestyle. If inflammation is the main issue, like with a herniated disc, epidural injections might help. If the pain is from arthritis or stiff joints, facet or SI injections may be better. If it's nerve-related, nerve blocks or RFA could be effective. And if it's muscular, trigger point injections might provide short-term comfort. But remember, every injection should be part of a bigger plan that includes stretching, strengthening, and correcting posture. Otherwise, you're only pressing mute on the pain, not resolving it. Not all shots are equal. Not every injection is dangerous, and not everyone is safe. The key is how often, where, and why it's used. If your doctor recommends one, ask these 3 questions. What's the exact goal? Pain relief or diagnosis? How long will it last and what are the risks? What's the next step after the injection wears off? Because an injection should never be the only treatment. It's a tool, not a cure. The real benefits and limitations of back pain injections. So, your doctor says an injection can fix your back pain, but what actually happens after the shot? Do you get your life back? Or does the pain just go quiet for a while? Let's reveal the truth about how injections really work inside your body. The benefits, the relief, and the limits no one talks about. 1. The science behind the relief. When you get an injection like an epidural or facet shot, the goal isn't to heal your spine, it's to reduce inflammation and interrupt the pain cycle. Think of your spine as a busy highway. When there's inflammation, traffic jams happen, nerves get irritated, pain signals keep firing, and your brain keeps receiving danger alerts. Steroid injections act like traffic police. They clear the jam temporarily, allowing your body to calm down and move again. This short-term break gives your body a window to heal naturally, especially if you combine it with stretching, gentle exercise, and posture correction. That's the real benefit. Injections can support healing, but they don't replace it. 2. The immediate benefits. Why many people feel so good afterward. Let's talk about the good part first, because yes, injections do work for many people. Fast relief. Many patients feel pain reduction within a few hours or days. It's almost like flipping a switch. The constant ache or shooting pain fades, and movement feels easier again. Better mobility. Reduced inflammation means joints and muscles move more freely. You can bend, walk, and even sleep without that stabbing discomfort. Improved mental health. Chronic pain is exhausting. Once relief sets in, people often feel lighter, happier, and more hopeful. That emotional lift is powerful. Diagnostic clarity. Sometimes injections aren't just treatment, they're a test. If a specific injection relieves pain, it helps doctors pinpoint which nerve or joint is causing the issue. Avoiding surgery. For some, injections buy valuable time, allowing healing to occur without going under the knife. These are all real, meaningful benefits, especially for seniors who want to stay active without heavy medications or risky surgery. 3. The short-term nature of relief. Now, here's the part most people don't hear clearly. The average pain relief from steroid injections lasts anywhere between 2 weeks to 3 months. In some cases, a bit longer, but rarely beyond 6 months. Why does the pain return? Because the source of the problem, the damaged disc, weak muscles, or arthritic joint, hasn't changed. It's like taking painkillers for a broken bone. The pain fades, but the break is still there. Injections stop inflammation temporarily, but once the medicine wears off, the same mechanical stress reactivates pain. So, if your spine alignment, posture, or core strength isn't improving, injections turn into a repeating cycle. Pain, shot, relief, pain, shot again, and that's the loop most adults fall into without realizing it. 4. The hidden limitations of steroid use. Corticosteroids, like cortisone or triamcinolone, are powerful anti-inflammatory drugs, but they come with a price when used too often. Possible side effects include bone thinning, osteoporosis. Repeated steroids can weaken spinal bones. Muscle loss. They can reduce protein synthesis, making muscles less resilient. Elevated blood sugar, dangerous for diabetics. Weight gain or bloating in some cases. Increased infection risk. Steroids suppress immune function. That's why most specialists recommend no more than 3 to 4 injections per year. But many people, especially those with chronic pain, end up exceeding this because it's the only thing that seems to help. That's when the risk outweighs the reward. 5. The psychological dependency trap. Here's a truth few talk about. Pain relief can become addictive, emotionally. When you've been suffering for months, even a few days of relief feels magical. You start associating injections with normal life, with the ability to walk, work, and sleep peacefully. So naturally, when pain returns, your brain craves that quick fix again. But dependency on injections creates a dangerous mindset. I need this shot to function. Over time, it discourages people from doing the real work that supports lasting recovery, like improving posture, losing extra weight, or strengthening their core muscles. The result? The pain cycle continues indefinitely, with temporary highs and frustrating lows. 6. The risk of masking bigger problems. This one is important, because injections can sometimes hide warning signs your body is trying to send. If pain comes from spinal degeneration, nerve compression, or instability, injections may silence the symptoms without addressing the root cause. That means you might feel okay for a few months while the actual damage silently worsens. By the time pain returns, the condition might be more advanced, making recovery harder. That's why experts emphasize using injections as part of a strategy, not the whole solution. You should always pair them with physical therapy, posture correction, and regular follow-ups. 7. What studies actually show? Let's look at what science says, because this is where the truth becomes clear. Short-term relief. Research consistently shows injections help relieve pain for up to 12 weeks in many cases. They can improve mobility and daily function, especially for people with sciatica or inflammation-related back pain. Long-term relief. However, multiple studies, like those published in the New England Journal of Medicine and Spine Journal, show no major difference in pain or function after 6 months between patients who got injections and those who didn't, as long as both followed exercise-based rehab. Placebo effect. Interestingly, some studies found up to 30% of injection benefit may come from the placebo effect, meaning the belief that you are getting something powerful plays a role in how your brain perceives pain. This doesn't mean injections are fake. It just highlights how deeply the brain influences our perception of pain. 8. The balanced truth. So, are injections good or bad? The real answer is, they're helpful when used wisely, harmful when overused. If you use them strategically with your doctor's supervision alongside therapy and exercise, they can give your body the break it needs to heal. But if you rely on them as a permanent fix, skipping movement, skipping strengthening, and just waiting for the next shot, you risk long-term weakness and dependency. The real success stories come from people who use injections as a temporary support, not a lifetime crutch. 9. The role of timing and precision. Another key factor, where and how the injection is given. A precisely placed injection under X-ray or ultrasound guidance is far safer and more effective than a blind one. Accuracy ensures medicine reaches the correct nerve or joint, minimizing risk and maximizing relief. So always ask your doctor, will this be done under image guidance? What are the possible side effects? What's your plan if it doesn't work? Never be afraid to ask, because it's your spine, your choice, and your right to know. The hidden dangers, side effects, and long-term impact of back pain injections. They told you it's just a small shot, quick, safe, and effective. But what if that same simple injection could weaken your bones, damage your nerves, and make your pain worse over time? In this part, we're uncovering the side effects and hidden dangers of repeated back pain injections, especially for adults and seniors who've been getting them for years. 1. Why repeated injections become risky over time. Let us be clear. 1 or 2 injections a year under a doctor's guidance are generally safe. But when you start getting them every few months, year after year, the story changes. Here, steroids, the main ingredient in most back pain injections, don't just calm inflammation. They also alter the way your body heals. When used occasionally, that's fine, but when used repeatedly, your natural tissue repair slows down. Muscles weaken, bones lose density, and the immune system becomes sluggish. So, while your pain may fade temporarily, your spine is slowly losing its long-term strength. Think of it like overusing a pain mute button. Each time you press it, your body forgets how to play its natural tune of healing. 2 common short-term side effects. After an injection, many people feel mild side effects for a few days. These are usually harmless and fade quickly, but it's good to know what to expect. Common short-term reactions: soreness or bruising at the injection site, mild numbness or tingling near the area, temporary increase in pain before relief sets in, called a steroid flare, headache or dizziness, especially after epidural shots, facial flushing or redness for a few hours, mood swings or mild anxiety for a day or two. These are typically short-lived. However, if symptoms persist or get worse, like severe headache, fever, or leg weakness, you should contact your doctor immediately. 3. Systemic effects. When the steroid spreads through the body. Even though injections are localized, a small amount of steroid can enter the bloodstream. That's when you might experience systemic effects, meaning the medicine starts influencing the entire body, not just your back. Possible systemic side effects: elevated blood sugar, risky for diabetics, temporary weight gain or puffiness, especially in the face or neck, fluid retention or swelling in the feet, increased appetite, hormonal changes, like mood swings or sleep disruption, lowered immunity, making you more prone to infections. For older adults or those with chronic conditions, these side effects can take a bigger toll. That's why doctors closely monitor steroid dosage and frequency. 4 long-term risks. What happens after years of injections? Here's where things get serious. When injections are used too frequently, especially steroid-based ones, they can cause lasting harm. Major long-term risks include bone thinning, osteoporosis. Corticosteroids decrease bone formation and increase bone breakdown. Over time, this makes your spine and hips weaker, increasing the risk of fractures, especially in postmenopausal women. Muscle weakness, steroid myopathy. Steroids interfere with protein synthesis, leading to muscle atrophy, shrinking. This makes it harder to maintain posture and stability, which ironically worsens back pain. Suppressed immune system. Repeated exposure reduces your body's ability to fight infections. Even minor ones can take longer to heal. Adrenal gland. Suppression. Your adrenal glands naturally produce cortisol, the body's steroid hormone. Frequent injections can trick your body into thinking it doesn't need to make any, leading to fatigue, weakness, and hormonal imbalance. Cartilage damage. Too many injections can damage joint cartilage, especially in the spine's facet joints, speeding up arthritis rather than slowing it down. Nerve damage or infection, rare but serious. If the needle touches a nerve or if bacteria enter the injection site, it can cause nerve injury or infection, known as epidural abscess. While rare, these can lead to permanent problems if untreated. 5. The domino effect. How one injection can lead to many. Here's what often happens in real life. You get one injection. It works great for a few months. Pain returns. You get another. Relief again, then pain again. After a while, the body builds tolerance, meaning each shot works less effectively than the last. The pain-free window gets shorter, so the frequency increases and the risks multiply. It becomes a cycle of dependence. Instead of addressing posture, movement, and muscle health, you're relying on an external fix. The result? Weaker bones, weaker muscles, and a back that's losing natural resilience. That's why doctors emphasize, injections are meant for occasional use, not lifelong therapy. It's not just the body that suffers, the mind does too. Chronic pain already takes a toll on emotional health. Add the ups and downs of injections, relief followed by disappointment, and you've got a roller coaster. Many people start feeling anxious before the pain returns, constantly watching the clock, wondering when they'll need the next shot. That anxiety can increase stress hormones and, ironically, make the pain feel worse. Studies show that stress, fear, and worry amplify pain perception. So while the injection numbs physical pain, it can quietly build emotional dependence. The key is to balance physical treatment with mental resilience. Mindfulness, breathing exercises, and counseling can all help you manage pain without relying solely on injections. Here's something powerful. Most people who depend on injections often skip the one thing that could save them from needing them: movement. Your spine is built to move, stretch, and strengthen. When you avoid movement out of fear or rely too much on injections, the supporting muscles, core, glutes, and stabilizers, weaken. That creates even more strain on your spine. Over time, even a small movement can trigger pain because the muscles aren't protecting the spine anymore. Simple lifestyle changes, like daily stretching, gentle yoga, posture correction, and strengthening, can reduce your need for injections dramatically. Even walking for 20-30 minutes a day improves blood flow and spine flexibility, helping your body heal naturally. 8. Safer use guidelines. If you're currently getting injections or planning to, here are smart safety guidelines recommended by spine specialists. Limit frequency. No more than 3 Tier 4 steroid injections per year in the same area. Track your results. Keep a journal of how long each injection lasts. If relief shortens, talk to your doctor. It may be time to try another method. Combine with therapy. Always follow up injections with physical therapy, core exercises, and posture training. Ask for image guidance. Make sure injections are done under X-ray or ultrasound. It's safer and more precise. Check your bone health. If you're over 50, ask for bone density tests periodically, especially with long-term steroid use. Don't skip follow-ups. Never keep taking injections without regular checkups. 9. The good news: the body can recover. If you've already had several injections, it's not too late. The body is incredibly adaptive. With movement therapy, proper nutrition, especially vitamin D, calcium, and protein, and slow withdrawal from frequent injections, You can rebuild strength and reduce dependency. It may take months, but many people experience lasting relief when they combine mindful movement plans, proper medical supervision plus natural healing methods. The road to real healing. How to free yourself from injection dependence. What if I told you there's a way to live pain-free without another injection? In this final part, you'll hear what spine experts actually recommend. Natural alternatives that rebuild strength, restore movement, and keep pain away for good. 1. What experts say. Injections aren't the enemy, but they aren't the cure either. Pain specialists around the world agree injections are tools, not treatments. They buy you time to work on what really matters, healing the cause behind the pain. Dr. Andrew Lieberson, a U.S. spine specialist, says, if a patient walks out of my clinic feeling great after an injection, but doesn't begin physical therapy within 2 weeks, I've failed them. The reason? Injections reduce inflammation, but don't correct posture, weak muscles, or tight joints, the real roots of back pain. That's why world-class rehabilitation centers pair every shot with an active recovery plan. Step 1. Reactivate your core and posture. Your core, the muscles in your abdomen, hips, and lower back, acts as the body's natural brace. When it's weak, the spine takes all the load. Best core activation moves for beginners. Pelvic tilts, 10-15 reps. Lie on your back, flatten your lower spine gently against the floor. Bird dog, 10 reps each side. On hands and knees, extend opposite arm plus leg while keeping your back straight. Standing marches, 1 minute. Simple but effective to wake up your hip stabilizers. Do these daily. Even 5 minutes makes a difference. Over time, your back starts relying on muscle strength instead of medication. 3. Step 2. Stretch to release. Tension injections. Calm nerves, but stretching teaches them to relax naturally. Tight hips, hamstrings, and piriformis muscles are major culprits behind sciatic and lumbar pain. Try these daily stretches. Cat-cow stretch mobilizes the spine. 10 slow reps. Seated hamstring. Stretch. Hold 20 seconds each leg. Knee to chest stretch. Releases lower back pressure. Hip opener. Lying figure 4. Great for sciatica. Stretching increases blood flow, boosts flexibility, and gradually retrains your spine to move without pain. Step 3. Fix your posture habits. You can do every exercise in the world, but if you spend 8 hours hunched over your phone or slouched on a couch, the pain will return. Simple posture habits. Keep your ears aligned with shoulders when sitting. Avoid sitting longer than 30-40 minutes. Stand or walk for 1 to 2 minutes. Use a rolled towel behind the lower back for support. Raise your screen to eye level to avoid neck strain. Good posture turns your spine from a victim into a strong support structure. Step 4. Strength through motion. Experts stress the phrase, motion is medicine. When you move, blood nourishes spinal discs and lubricates joints. Recommended low-impact activities. Walking 20-30 minutes daily. Swimming or water aerobics. Stationary cycling. Gentle yoga or Tai Chi movement tells your nervous system, you're safe. Over time, it rewires pain responses and lowers sensitivity. No needle needed. 6. Step 5. Fuel your spine with nutrition. Nutrition is a silent healer. Inflammation-fighting foods can reduce swelling as effectively as low-dose steroids, without side effects. Anti-inflammatory foods. Leafy greens, spinach, kale, berries and cherries, turmeric, with black pepper for absorption, omega-3 sources, salmon, flax seeds, ginger and green tea. Bone strengtheners, calcium, from milk, almonds, sesame seeds, vitamin D from sunlight or supplements, magnesium for muscle relaxation. What you eat daily can build the same internal protection that injections temporarily provide. 7. Step 6. Mind-body connection and stress relief. Doctors now recognize pain is not just physical. Stress and fear can intensify it. That's why leading rehab centers add mind-body techniques alongside therapy. Simple stress relief methods. 5 minutes of deep breathing morning and night. Guided meditation for pain acceptance. Gratitude journaling to shift focus from pain to progress. Listening to soft music or nature sounds before sleep. Reducing stress lowers cortisol, a hormone that triggers inflammation, helping your body heal faster naturally. 8 expert alternatives to steroid injections. If injections are necessary, consider safer or adjunct options. Modern alternatives include platelet-rich plasma, PRP. Therapy uses your own blood to boost healing of tissues naturally. Prolotherapy stimulates the body's repair process by injecting sugar solution. No steroids involved. Dry needling or trigger point. Therapy releases tight muscles without chemical drugs, nerve blocks with local anesthetic. Only short-term relief without steroid risks. Always discuss these with a qualified pain specialist. They can help design a plan that fits your age, health, and lifestyle. 9. Build your natural healing triangle. Spine experts say lasting relief comes from 3 pillars working together: movement plus nutrition plus mindset. If one side is weak, the triangle collapses. But when you move regularly, eat anti-inflammatory foods, and maintain a positive, calm mind, your body becomes its own healer. It's slow progress, but permanent progress. And that's something no injection can ever match. Advice from pain experts. Here's what the best doctors recommend if you're currently relying on injections. Use them strategically, not habitually. If you need one to function, fine, but plan a movement program immediately after. Strengthen before you numb. Build core stability so you don't need pain numbing often. Track your progress. Notice improvements in mobility and pain-free days. Celebrate them. Stay patient. Healing isn't linear. Some days will feel hard, but each movement is a victory. Get regular checkups. Never continue self-directed injections without medical guidance. Your back pain does not define you. It is not a life sentence. It is a signal from your body asking for care, movement, and balance. Remember, real relief doesn't come from a needle. It comes from your daily choices. Every stretch, every walk, every moment you sit up straight, you're rewiring your spine for strength and freedom. You have the power to heal naturally. Start today, one step at a time. Did this series help you understand injections better? Hit like if you learned something new, and subscribe for our next series on natural fixes for chronic pain. Share this video with someone who has been getting back injections. You might change their life today.